The first week of the life of a baby chick is characterized by intensive welfare and management, to keep them away from harsh environmental conditions and protect them against diseases, which may be detrimental to the overall growth and performance of the baby chick. Taking care of a baby chick can be so challenging, especially in the first 7 days of life. These challenges include harsh weather conditions and life-threatening chicken diseases, and which may lead to high mortality rates and poor production. Therefore, it is essential you plan ahead on how to prevent these common chick diseases and their treatment in case of any eventualities. So in this video, we are going to look at 6 common chick diseases you have to watch out for. These will also include their symptoms, prevention, and treatment. So if this is your first time of watching our videos, do ensure you subscribe and also turn on the notifications bell so that you can get notified each time we drop a new video in this channel. Here are the 6 most common chick diseases that affect hatchlings and baby chicks. At number 1 is the Calibacillosis in chickens. Calibacillosis is one of the major infectious bacterial diseases in baby chicks and laying chickens. It is caused by Escherichia coli, which are always found in the gastrointestinal tract of birds and disseminated widely in feces. Therefore, birds are continuously exposed through contaminated feces, water, dust, and the environment. Neonatal chicks can also be a consequence of poor chick quality and sanitation in the hatchery, leading to early chick mortality. Symptoms: fever and lethargy, difficulty in breathing, diarrhea, and coughing. Prevention and treatment: practice good sanitation, especially during hatching and brooding. Avoid overcrowding and stress. Stress from extreme temperature, air saturated with ammonia from the heavy litter can trigger stress in your chicks. E. coli is not easily treated, and different strains react to different drugs. However, antimicrobial drugs have been used to treat Calibacillosis. Although there are still some effective drugs used in treating Calibacillosis, you have to consult a veterinarian before use. Suggested drugs: chlortetracycline or aureomycin, erythromycin or galamycin. 2. Infectious bronchitis. Infectious bronchitis is an acute, highly contagious upper respiratory tract disease in chickens. Infectious bronchitis virus is an avian virus that only causes disease in chickens. IBV is shed by infected chickens in respiratory discharges and feces, and it can be spread by aerosol, ingestion of contaminated feed and water, and contact with contaminated equipment and clothing. Symptoms: heavy breathing, gasping, mucus discharge from eyes, and sneezing and coughing for 10–14 days. Chicks may look depressed and huddle under a heat lamp. You may also observe a reduction in feed consumption and a reduction in weight. Prevention and treatment: administer antibiotics and increase the room's temperature will help to reduce mortality and cold. The prevention of infectious bronchitis, IB, in chickens is achieved through the use of live and inactivated vaccines, which provide protection against virulent field IB viruses in the event of exposure. So, there is no actual medication that could change the course of the infection. Antibiotics given will only help to treat opportunistic diseases usually caused by bacterial infections and reduce mortality. Proper management and sanitation is the key to surviving it. 3. Necrotic enteritis. Necrotic enteritis is an infectious disease that affects chicks, in their first few weeks of life. It is characterized by rotten-smelling diarrhea and weakness. It is a bacterial infection that usually spreads through congestions and overcrowding. Other risk factors may include rough handling by farm workers, consuming mycotoxin through feeds, poor sanitation practices, protein deficiency, etc. Necrotic enteritis primarily affects 2 to 5 week old chickens. Symptoms: rotten-smelling diarrhea and listlessness are the major signs. Other signs include ruffled feathers, depression, reduced appetite, and slow weight gain. Prevention and treatment: avoid exposure to extreme temperatures that may trigger stress. Store their feed properly and inspect on a daily basis. Don't overstock your birds to avoid overcrowding. Supplement feed with yeast extract, prebiotics, MOS, probiotics, organic minerals, and enzymes. For treatment, you can give supportive care and administer antibiotics like neomycin and other supplements like probiotics, amino acids, and thyme. 4. Brooder pneumonia in chicks or the aspergillosis. Aspergillosis is a fungal disease that normally causes pneumonia in chicks. Thus the name, brooder pneumonia. The fungus responsible for aspergillosis is known as aspergillus. This fungus can be seen growing in feed, bedding, and in extreme cases in animals' tissues. It is usually spread by aerosol of spores, which are common in the hatchery, and spread less commonly by contaminated dust and litter in the house. Symptoms: difficulty in breathing, tremor, sleepy, emaciation, very thin. In extreme cases, conjunctivitis, high mortality, and cloudy eyes can be seen. Prevention and treatment: proper sanitation like fumigation of eggs, machines, and air dust, etc., should be carried out in the hatcheries regularly. Reduce water spillage by using clean dry litter and dry cups or nipples. Also, add antifungals in the feed or water. For the treatment, there is no effective treatment. The key to control is to minimize exposure of chicks to contaminated materials. 5. Omphyletes in chicks. Omphyletes are a condition that primarily infects the yolk sac of a baby chick, often noticed by unhealed navels. It is infectious but non-contagious and is associated with poor regulation of incubation temperature or humidity. The major cause of omphylitis is the contact of an open navel with contaminated surfaces that may harbor opportunistic bacteria. Extreme cold or heat can also increase losses. Symptoms: open and inflamed navel, depression and anorexia, huddle near a heat source, drooping head, slow weight gain. Treatment and prevention. No specific treatment for omphyletes. An antimicrobial drug given is to prevent further damage by opportunistic bacterial. Even at that, treatment may not result in satisfactory outcomes, due to the severely affected chicks often die, and unaffected chicks are unlikely to be aided by antibiotic treatment. The disease can be prevented by careful control of temperature, humidity, and sanitation in the incubator. 6. Salmonella or the pylorium. Pylorium in chickens, chicks, also known as bacillary white, is caused by Salmonella enteric pylorium. It is characterized by very high mortality in young chickens. Transmission can be via direct or indirect contact with infected chicks or contaminated feed, water, or litter. Hatchery contamination usually results in death between 2 to 3 weeks of age. Symptoms: pasty white fecal material on the vent, depressed and weak, huddle near a heat source. In some cases, the chick may have respiratory disease, blindness, or swollen joints. Prevention and treatment. Avoid all means of contamination and eliminate any affected birds, and flocks are the key to control. Treatment will have little or no effect and is never recommended. So in conclusion, from all indications, you will agree with me that proper sanitation and management is the key to keeping your chicks safe and healthy. If you find this video helpful, please share and comment.